Hi everyone, this is Tom, and in this video I'm going to go through a demonstration of the testing sandwich. The testing sandwich is a technique that I've kind of adapted over basically 20 years of doing exam after exam after exam, and refined it down to a really clear process that has worked really well for me. And when I've taken other people through it and they've implemented it, it's also worked really well for them. So hopefully from this video, you can get a demonstration of exactly what it looks like, try implementing it and see if it works for you as well. The idea is that you're testing yourself a lot, and it involves testing before and after studying a topic, and then doing lots of free recall during the topic. And the idea is this really embeds the information. So what I'm going to do in this talk is start with introducing some of the principles, the reasons behind doing the testing sandwich. Then I'm going to take you through the exact structure of the testing sandwich. And then I'm going to actually do a demo where we're going to go through cardiology. So I'm from a medical background. I've done loads of medical exams. A lot of people watching will be from medicine, but this can be applied to any kind of specialty or thing that you're studying. So it could be engineering, law, accountancy, psychology, any kind of technical exams. You can apply this exact system to those exams too. We're going to go through cardiology today using the Zero to Finals resources, but I'm going to make a whole new video all about how to create your own resources very efficiently using AI if you don't have something like Zero to Finals where you can get started straight away. But let's get straight into it. So this is on the testing sandwich. So there's a couple of really important principles that are worth knowing about so you understand why you're doing the testing sandwich. If you're just kind of doing it because somebody told you to do it, I don't think that's necessarily a good reason to do it. I think it's worth having a really good reason and understanding of why you're implementing it like this. So the first thing is the forgetting curve. So what's the forgetting curve? If you watch my other videos, you'll probably be familiar with it. But basically, you've got time and you've got memory. So this could be memory, understanding, retention. So this is the stuff you're trying to keep in your memory when you study a topic. So what happens is you study a topic and you start up here. Maybe this is like 80% or 90%. And what happens is your memory drops really quick and then it kind of plateaus down at the bottom. So within a few days of studying something, you'll have forgotten most of what you studied. You'll be down to like 20 or 30%. So what the testing sandwich does, if you implement the testing sandwich as a study routine, as your study strategy, it boosts this line up. So instead of this line here, you'll actually retain it a bit better. So it's actually a routine for, let's see if I can do something that makes sense. So this is what you're doing. You're boosting this line so you retain more information after the study session. And actually the line will start higher because you'll have retained and understood more of it. Still, this is the first repetition. So this is the first time you go through a topic. You'll notice that even though you've boosted this line, so you're getting more information to go into your brain and stick there longer term, you still have the issue of it does still drop to, say, 30, 40% after a week or so. So the only solution to this is spaced repetitions. So this would be the second time you do the testing sandwich of that topic. So you do cardiology today, You do cardiology with the testing sandwich again in, say, 10 days, and then you do it again in, say, 3 weeks. And these spaced out repetitions are what get it to stay long term. So then when you're on your exam day here, your knowledge is way up high, as opposed to just 2 repetitions, just 1 repetition with the testing sandwich, or 1 repetition of just kind of absorbing the information passively. So that's the forgetting curve. The only other thing I want to talk to you about before we move on to the testing sandwich is the internal and external database principle that I talk about quite a lot. So you've got your external database. You can think of the external database like your notes. So for this purpose, we're using the Zero to Finals medicine book as the external database for our read and recall aspect. And we're using the Zero to Finals member site for the question aspect of the external database. So the external database needs to contain both written info and questions. You need a combination of written info and questions in your external database, which you get from the medicine book and the question bank. Then you have your internal database. So this is a brain. So this is what you know. This is actually what's stored in your brain. And this is what's important for your exams. So you want when you're in your exam, or when you qualify and you're a doctor or you're an accountant or a lawyer or an engineer, whatever it is, what's important is what's in your brain. What's in your external database is not important, because the external database is just a tool for transferring information to your brain. So when you're doing the testing sandwich, you're getting the information from the external database and downloading it into your brain. So you can think of this as like, you're getting you're using, say, a USB stick that you plug into your computer and downloading everything from that USB stick. The external database is the USB stick. Your internal hard drive is your internal database. So you're just the only purpose of the external database is to download it into your memory. Otherwise, at the end of your semester, it's useless. Then you have resources. So these are things like lectures, textbooks. So traditional, big, bulky textbooks that are difficult to manage. And I'm going to make a video all about how to manage these challenging textbooks. Then you've got like teaching sessions. Then you've got things like the internet. So you might be watching videos or listening to podcasts or whatever it is. And these resources, what you're doing is you're capturing them in one place. So if you're having 100 different resources that you're trying to learn from, it gets very complicated. And what you want to do is have one place, which is the external database, where you capture the information you need to know, and then you use that external database to transfer it to your internal database. Of course, when you are going through, watching videos online, listening to podcasts, listening to lectures, reading through textbooks, going to teaching, you are also transferring information. So this would be like learning experiences. So during going through these things, lectures and so on, you are still learning stuff, and these are learning experiences, But the testing sandwich, that applies here. That's what you're doing with the testing sandwich is it's the technique for taking information from your external database and putting it in your internal database. Testing sandwich has got nothing to do with these, nothing to do with your kind of learning experiences. They're still incredibly valuable for your exams. But when it comes to just taking information from your notes and putting it in your brain, that's where the testing sandwich comes in. So let's go through the testing sandwich. So, what is the testing sandwich? Well, it's something you do in a single study session. So you get to the library, you get to wherever it is you work, and you've dedicated a few hours, so it would be 1 to 3 hours. You've dedicated to the single topic, so it could be cardiology, it could be respiratory, something that you can cover by pushing yourself in 1 to 3 hours. And you're going to study one topic in that study session. So this is how it works. So you're going to have to, before you get started with doing testing sandwiches, cut down what you need to know in your exams into blocks of single topics that you could study in 1 to 3 hours using this technique. So the first step here is to do short answer questions. So you take these short answer questions. When you sit down, you get to the library, the first thing you do is short answer questions. And we're going to go through a full demo on how to do this very shortly. And so the short answer questions, what you're doing is you do 10 to 30 SAQs. So you sit down and you blast through 10 to 30 short answer questions on the topic you're about to cover. And the idea behind this is you get your baseline knowledge. So if it's been a few weeks since you studied cardiology, or this is the first time you've ever studied cardiology, by doing these short answer questions and figuring out how much you know, you get an understanding of your baseline knowledge. So you know your baseline knowledge on cardiology is like 35% or 60% or 90% if you're really good at it. So it's a really helpful way of giving you feedback before you even study to say what you know already. It's okay if it's the first time you study it and you get 10%. That's fine. That's kind of to be expected. It's the first time you've ever done it. But if you get 90% doing it the first time you've ever studied it, it may be worth just calling it a day there and moving on to a topic where you're going to score worse. And the other useful thing about this is priming. So priming is the idea in psychology where if you kind of touch on some information before you do the kind of big thing, your brain becomes primed to absorb more. So by doing these short answer questions, even if you have no idea what the answers are, what happens is your brain becomes primed. It kind of wakes up and it says to itself, I need to pay attention here because I'm going to get tested on this stuff. And then when you go through and study that information, you absorb it much, much better. So it primes you ready for the study session. If you just go into reading the topic cold, your brain's kind of sleepy. The first couple of pages, you won't really absorb them. But if you've done some short answer questions, you are ready and primed. So this is number one. Then when you've finished your short answer questions, then you go on to read and recall. So this is, which we've been through in a different video, is where you start with free recall on the topic. So you're doing lots and lots of free recall. The way you make memories is to retrieve that information from your memory. So what you have to do is you kind of put it in and then you retrieve it. And it's the process of retrieving it that really creates the memory and creates those strong connections in your brain. If you just put it in, what happens is then it just kind of leaks out like a sieve. But if you put it in and then you recall it with free recall, that's what helps it stick. It also fills your gaps. So if you just do the questions, there'll be all these gaps between questions that you don't have knowledge and information on. But by doing read and recall, you're filling in the gaps. You're helping your understanding. So a lot of people these days just do Anki or just do MCQ banks. But if you don't combine testing with free read and recall, you'll have all these gaps in your knowledge and your overall understanding won't be very good. So that's what read and recall is for. And I would say aim for 60 to 80% for each rep. So what do I mean by this? Well, when you do your first repetition of covering, say, cardiology, you're not going to be able to get all of the information in cardiology that you read to stick in your brain, even short term. And there'll be things that you cover where you think, I don't really understand this completely. I can't get my head around it. And you get stuck. Try not to get stuck. Try to keep going. And remember that you're going to do multiple repetitions. So on that first repetition, or it could be the second or third, you're not aiming for 100% kind of understanding and being able to recall it. Just pick out, as you go through each rep, pick out the important things that you want to learn in that study session. Try and get an overall picture, pick out the important things, try to understand some topics that you think are important or some content, and then just keep moving forwards, knowing that you will come back to it. So that's number 2, read and recall. And then number 3, put number 3 here, is you do multiple choice questions. So these 3 are all in the same study session, in the same 1 to 3 hour session. So what do you do with multiple choice? You're applying your knowledge. So you've just read through, say, cardiology, and now you're doing multiple choice questions on cardiology. What you're doing is taking that information and applying it to a scenario in an exam setting. So the other thing you're doing is practicing. You're practicing the exact format for your exams. And you're taking advantage of the testing effect. I've got a whole video from years ago on testing where I go through the testing effect. But essentially, it's proven that if you just study information multiple times, it's more powerful for retaining information instead of studying it over and over, to do studying and testing over and over. So the testing effect says testing yourself helps you retain information a lot longer. And finally, you're consolidating. And the multiple choice questions also kind of highlight where you've missed stuff. So you might have read through, think that you've retained quite a bit or understood quite a bit. You do an MCQ and it picks out your weaknesses and shows you that you didn't really pay attention as well as you thought you would. So it kind of gives you feedback as well. And then this helps you to get better at the study technique, because it feeds back to say, you weren't paying attention as well as you thought. The next time you do a study session, you can kind of pay attention a bit better, in a sense. Okay, so let's go through the demo on how to do that testing sandwich we just talked about. So what we need is, I've got my Zero to Finals medicine book here. I've got a pad of paper for jotting down things and not making a set of notes. This is not creating an external database. I'm just using this as a way of transferring information into my brain. And we've got we're logged into the Zero to Finals members site. So remember, the testing sandwich starts. I've just arrived in the library. Here I am. I'm going to study cardiology, which is the first section of this Zero to Finals medicine book. Before I start this, the first part of the testing sandwich is to do short answer questions. So let's start. We've got the member site here. Click on the short answer questions. I'm just going to reset this. So we're going from a blank slate. And we're going to select cardiology questions. And we're going to get started. So let's start going through some questions. Remember, we're going to do 10 to 30 questions to prime ourselves and know where we're up to. So question 1, what is the first line class of antihypertensive medications in patients with type 2 diabetes? So I think the answer is, and you can commit this to paper, which is ACE inhibitors. Super. Let's check the answer. Yes. So I got that one correct. I'm going to tick that box. Next question. What examination finding suggests accelerated hypertension in a patient with blood pressure above 180/20? I'm going to say retinal hemorrhage. Check the answer. Retinal hemorrhages, but I didn't get papilledema, so I'm going to leave that one. Okay. Where on the chest is the aortic area? I'm going to say second intercostal space, left sternal border. Second intercostal space, right sternal border. So I didn't get that correct. So in that case, we leave it blank, 0 correct. What does the second heart sound represent? So I'm going to say second heart sound is closure of the aorta and pulmonary valves. Closure of the pulmonary and aortic valves. Once systolic contraction is complete, give myself that one. What is the initial choice of statin and dose for primary prevention? I'm going to say atorvastatin 20 milligrams. That's great. How much aerobic activity per week is recommended? I'm going to say 30 minutes. Okay, that was wrong. Next question. What device is inserted in the chest delivers a defibrillator shock if it identifies VT or VF? I'm going to say, for the sake of this, just a standard pacemaker. No, it's an implantable cardioverter defibrillator. Okay, what are the causes of aortic stenosis? I'm going to say age-related, congenital, I think bicuspid valve. And then we could say maybe like connective tissue disorders. Okay, check that. Age-related, bicuspid valve, but rheumatic heart disease is something that I got wrong. Alrighty, a combination of which 3 classes of medications are used if required to control high blood pressure? Calcium channel blockers, ACE inhibitors, diuretics. Yep, but I didn't get thiazide-like diuretics, like indapamide, so I'm going to leave that one blank and challenge myself there. What drug is the usual pill-in-a-pocket treatment for paroxysmal atrial fibrillation? I'm going to say bisoprolol, so I got it wrong. Leave that one blank. What valve pathology commonly occurs with hypertrophic obstructive cardiomyopathy? I'll say aortic stenosis. It's mitral regurg, so that's wrong. So you would then continue. We've got to question 12 here, but you would continue for between 10 to 30 questions and get yourself primed. So let's say I'm feeling primed at this point, feeling good. I would then finish the topic. I scored 50%. So what you can actually do, and I'll go through tracking in a second, But in the Zero to Finals medicine book, I've actually added a tracking table. So if you open it up, you've got the contents here, but then you've actually got a kind of tracking table here. So I'm going to put today's date, which is the 18th of April. And I'm going to say for the short answer questions, I scored 50%. So then I've started tracking that, but I'm going to track it more as we go through. Okay, let's get started. So at this point, what we're doing is doing our read and recall for cardiology. So I'm going to open the topic. Here's what we need to go through. Got about 50 pages to go through. We've got cardiovascular disease, stable angina, acute coronary syndrome, pericarditis, left ventricular failure, heart failure, hypertension, valvular heart disease, prosthetic heart valves, infective endocarditis, cardiomyopathy, atrial fibrillation, SVT, arrhythmias, and pacemakers. So quite a lot of content to get through. Remember, we only have about 3 hours for this, so we need to push to get through it. Obviously, I'm not going to sit here for 3 hours and go through everything, but we're going to have to go through fairly quickly. So cardiovascular disease, because we're doing the read and recall technique, before I even get started, the first topic was cardiovascular disease. So I'm going to make a note, cardiovascular disease. I'm going to write down the things from cardiovascular disease that I think are most important to be able to recall. So I would say the first one is modifiable versus non-modifiable risk factors. One of the key risk factors that you would check is cholesterol. And a particular risk factor is familial hypercholesterolemia. Next one is to calculate the risk of cardiovascular disease, use the Q-risk score, and it's the Q-risk-3 score. And the threshold, I'm not sure. So what's the threshold for primary prevention? Primary prevention is with a statin, but I can't remember which statin. Secondary prevention is with aspirin, statin. What else do they use? I think there was a mnemonic that starts with A. So statins, atenolol or beta blocker, and I can't remember the rest. So these are the key points that come to mind about cardiology that I think are important to remember. Let's go through cardiology and using the read and recall technique and see where we're up to. So they're the things, I'll keep that there. So start with cardiovascular disease. So cardiovascular disease, atherosclerosis in the artery walls. And what you can actually do is have a quick flick through. So you've got cardiovascular disease. We talk about the diseases, risk factors. So we did modifiable, non-modifiable, medical comorbidities that can increase the risk. Okay. The prevention of cardiovascular disease. Okay. Primary and secondary prevention, modifiable risk factors, diet and exercise, primary prevention, statins, other lipid lowering drugs. Okay. I've got to think about those. Secondary prevention, familial hypercholesterolemia, which we talked about. Okay, so let's get started going through it. So cardiovascular disease is atherosclerosis. Okay, atherosclerosis. What is atherosclerosis? It is, so at this point I'm kind of doing it from memory. Atheromas. So these are like builds up of abnormal material in the artery wall, and then sclerosis is hardening. Yeah, atheroma is a fatty deposit, sclerosis is hardening. Okay. The risks are with chronic inflammation, immune system, and lipid deposition. Okay. Leads to stiffening, stenosis, and plaque rupture. So stiffening, stenosis, and plaque rupture. Okay. Cardiovascular diseases, angina, MI, TIA, strokes, peripheral arterial disease, and chronic mesenteric ischemia. Okay. Let's have a look. Risk factors. So modifiable and non-modifiable. So it's things like age, being male, family history. And then modifiable are things like cholesterol, being overweight, poor diet, low exercise, smoking, alcohol. See if I missed any. Stress and obesity. Yep. Alcohol, smoking, raised cholesterol. Okay. So medical comorbidities. The key ones would be diabetes, renal disease. I suppose there's some other kind of cardiovascular disease. Now let's have a look. So diabetes, high blood pressure, hypertension is a key risk factor. Hypertension. Inflammatory conditions, yes, okay. Inflammatory conditions like rheumatoid arthritis. Yeah. So these are key risk factors. And then atypical antipsychotics. Okay. So what you can do is, as you're going through, you're constantly kind of testing your current knowledge and then comparing it to what's on the page. And then making a note, a mental note, or scribbling down, or whatever helps you, saying it out loud from memory, the things that you need to remember. So now we're looking at prevention of cardiovascular disease. So we've got primary and secondary prevention. Primary prevention, secondary prevention. Okay. Optimizing modifiable risk factors. Okay. So losing weight, cutting down on smoking, cutting down on alcohol. Yep. Smoking, reduce alcohol, and then comorbidity. So treating diabetes and things. Then there's diet and exercise. Okay. So I think they talk about this Mediterranean diet. And then exercise. How much exercise? So we had a question on this, and I was way off. It was actually much higher. So it was 150 minutes of moderate intensity or 75 minutes of vigorous intensity, plus strength training at least 2 days a week. So you're following me on my journey in this video series, and I'm probably not hitting these recommendations. I'm doing strength training. I suppose moderate intensity climbing would count, so I'm hitting those. And then primary prevention. What do they give for primary prevention? I said statins, but I couldn't remember what it was. Curious 3 score? Yes, I remembered that. But I didn't remember this threshold. Okay, so the threshold is 10%, is the key threshold. And then below 10%, you wouldn't rule out a statin in someone who's higher risk. This is something I didn't get, which is the age. So you would do the Q-risk score for patients. Let me try and remember it. 25 to 80? No, 25 to 84. 25 to 84. Okay. That's the group you use it in. Okay, atorvastatin 20 milligrams. Okay, that's important. So statins, how do they work? They reduce cholesterol production in the liver. They inhibit HMG-CoA reductase. HMG-CoA reductase. That's what they inhibit. Okay. Checking lipids 3 months after statins, increasing the dose to aim for a 40% reduction. So statins, what would you do? First, you do the Q-RIS 3 score. So this is me recalling it from memory what I've just read so I can put it into context. So you've got a patient who's 25 to 84. You do the Q risk-free score, and then you would offer them a statin, a torvastatin, 20 milligrams, if the Q risk-free score is above 10%. Then you would check the lipids again at 3 months, and if it's you're aiming for more than a 40% reduction in the, I can't remember what they said, in the non-HDL cholesterol. Okay. NICE also recommends checking the liver function test at 3 months and 12 months. Okay, so we need to do, at 3 months, we need to do lipids, and we want a 40% rise in non-HDL cholesterol, and we need to do the liver function test to look for the ALT. Super. Rare but significant side effects of statins. Let me see if I can remember these. So one is they talk about muscle aches and pains. Other side effects of statins, liver affected? I'm not sure. So then we look, myopathy, so muscle weakness and pain. Rhabdomyolysis, so severe muscle damage, and you check the creatine kinase. Okay, so rhabdo, you check this creatine kinase. Okay. Also type 2 diabetes. Interesting, it puts up the blood sugar levels. And hemorrhagic strokes, which it says are very rare. Usually the benefits outweigh the risks. Okay. One critical interaction is with macrolide antibiotics, like clarithromycin or erythromycin. I want to remember statins interact with clarithromycin or erythromycin, and they need to stop taking it. Super, let's move on to the next one. So at this point, so we could do these other cholesterol-lowering drugs. So you would say, what if they couldn't have statins? What would they have instead? I think there's ezetimibe, but I can't remember any of the other ones. So you go through those, and then you might stop and recall. Okay, it was important. Some important things I didn't remember. You need to use the QRIS-3 score, 24 to 85, 25 to 84. And if it's above 10%, a torvastatin 20. At 3 months, you check the lipids and the liver function tests. You want a 40% reduction in non-HDL cholesterol. And the rare side effects of statins, type 2 diabetes, I remember, myopathy, was it myopathy? Yep. And rhabdomyolysis. And rarely hemorrhagic stroke. And then that key interaction was with erythromycin and clarithromycin. So what you'll recognize I'm doing here is I'm absorbing some information. Well, first of all, I'm trying to recall the information without knowing it. Then I'm reading it and filling in the gaps. Then I'm stopping and recalling the information from memory. And it's when I'm recalling it, that's what writes it to the memory. That's what makes it stick in the memory. So we've got this far, but what you would continue doing is this process and keep going, pushing through, all the way till the end of the chapter. So this would take you, cardiology is probably the biggest section, but this would take you to get all the way to page 52. That's going to take you probably 3 hours. This is the biggest kind of topic. If it's getting really intense and, you get to that 3-hour mark or maybe 2 hours and you're thinking, I just can't get any more information in, or I really need a break, that's fine. Take a break and then come back that afternoon or the next day and pick up where you left off. But the important thing is you're doing one study session, without kind of taking a break, without going on to something else. So I don't mean do half of cardiology, then do some of respiratory, then do some of something else. Make sure you get the whole way through cardiology. It might take you a bit longer when you're first going through a topic, in which case you don't necessarily have to do as much of this kind of focusing on the topic. You're just trying to get through it. So you might go a bit faster. When you have done it like 3 times before, you'll be able to go very fast over the things that you already remember, and then you'll be able to really hone in on the details that you didn't pick up from the last time. So now we've finished, let's say we've been through the whole of cardiology there. Now what I recommend doing is you go back to this where you did the study session and you rate your confidence. So I'm going to say I have pretty medium confidence on that particular topic. And now, so we've done the short answer questions, we've done read and recall. Now we need to do step 3, which is the multiple choice questions, which means, put this to one side, we're going back to the Zero to Finals member site, and we're going to go to multiple choice questions. We're going to select cardiology here, and we're going to unselect that. We're going to start learning. So let's start doing some cardiology multiple choice questions. Okay, the first one. Question 1. A 21-year-old student presents to his GP with palpitations. He reports episodes where his heart suddenly misses a beat. He is then more conscious of his heart beating for the next few minutes and becomes aware of occasional irregularities. This happens several times a week and generally occurs when he's resting, blah, 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 blah. He's pretty fit and healthy, does half marathons, drinks lots of coffee. His heart sounds are normal, pulse is a bit low, and his ECG is as follows. Ambulatory ECG monitoring records similar findings. What's the cause of his symptoms? Well, based on this looks like a ventricular ectopic. So I'm going to click ventricular ectopics, check the answer, and that was correct. If you didn't know the explanation, you can see it here, where you can watch a video. Then you go to the next question. Here's a little tip for you when you're answering multiple choice questions, particularly in exams. If the question comes up like this, the first line to read of the question is the actual question. So, what is the major risk associated with this ECG finding? So, if you go straight to what the question is asking, often you can skip a lot of this information. So because it's asking specific about this ECG finding, and you look at the ECG and you see, wow, that T wave is a long way off. This looks like prolonged QT interval. And then you can actually skip reading through a lot of this stuff. But if you can't skip it, when you go back and read through this, you'll be able to better pick out the relevant information because you know what the question is going to ask. So you read through this, but we know prolonged QT, and we just read it, and we know that it's Torsades de Pointe. So we check that. Super. Got that question right. Next, we've got 64-year-old. So we go straight to here. What is the next most appropriate step in managing his high blood pressure? Okay, so we know this is about treatment of high blood pressure. So when we go through this, we can pick out the key points. So we've got a 64-year-old man, so his age is relevant, attending a follow-up with his GP, recently completed a set of home readings, and his blood pressure is high. So our target would be 135/85. He takes ramipril and lercanidipine. So he's got an ACE inhibitor and a calcium channel blocker. And he takes atorvastatin, feels well in himself. And he's already following lifestyle advice. So sodium is okay. Potassium is okay. Urea, creatinine are all. Creatinine's a little bit high. EGFR is a little bit low. HbA1c is okay. And his urine albumin creatinine ratio is a little bit high. So what's the next most appropriate step? So we're going to add another drug in. He's already on ramipril and lercanidipine. Let's say for the sake of this, you choose spironolactone. And check the answer. Oh, the answer is indapamide. Let's use this as a learning opportunity. So step 1. Step 2, we've got 2. So he's now on ACE and calcium channel blocker. Step 3, which is what this question was asking, is A plus C plus D. And D is thiazide like diuretic. Okay. So this is where I went wrong. Okay. So then you go through these, you go the whole way through, and I would suggest that you do at least 10 multiple choice questions. But if you have the time, I would go through every single one of these, all 30 questions, because they're all going to be very valuable. And they're all good learning experiences. And it shouldn't take you that long. And we click finish. And now we have, we've got exactly 50% again. So now we can go back to our tracking tool inside in the medicine book. And we can add MCQs. We got 50% as well. So we did our MCQs. Now we've tracked our study session. It was on this day, medium confidence. Short answer questions was 50% and multiple choice questions was 50%. Okay, so now we know where we stand with cardiology. Next time we'll go on to our weakest topic. So it could be renal medicine is our topic that we really hate and we don't want to do. So that's the next study session. We're going to do renal medicine. And we fill all these in, then we start on the second study session with spaced repetitions. But there is another way you can do it. You can actually go to the tracking tool on the Zero to Finals member site. Go to the tracking tool. We're preparing for medical school finals. And let's just delete this so we can give ourselves So we come to our tracking tool on Zero to Finals, the member site. We've got medical school finals, which is in 8 weeks, and we've just studied through cardiology. So let's record a study session. Studied cardiology on today's date. Our confidence was medium, and we'll save that. And actually, cardiology is recorded today's date, medium confidence. And actually, it's pulled through the short answer questions and multiple choice questions score there. So that's recorded. And guys, it's been a week since we did gastro. So we need to think about doing gastro. But first, we've got all of these topics to cover. And we can see our progress here on the member site. So there you have it. That was the demo of the testing sandwich. We went through cardiology, starting with short answer questions, then the read and recall strategy, then the multiple choice questions, and then we recorded everything in our tracking table. So it's really important to track your results. And you've got two options, which we went through. One is a physical table. So that one was already in the Zero to Finals medicine book, but you can create your own table using Excel numbers or just doing a hand-drawn one so that you can record all your results. Or the member site tracking tool. Few final principles. One is spaced repetitions. So what you're doing is with each repetition, you're going through in exactly the same way, short answer questions, read and recall, multiple choice questions. With each repetition, you're kind of doing, even though you're doing the same thing, covering the same material in the same way, you're kind of doing a different strategy. So you're, instead of what you're trying to do is just pick out the key things for that particular study session that you want to remember. Remember, you're trying to aim for 60 to 80% retention, immediate retention, and understanding of the content. So you don't need to be 100%. You don't need to get stuck on things. If you're feeling like you don't quite understand a topic, that's fine. Keep moving. And then what will happen is the next repetition, suddenly you'll understand it. In the interim, your brain will process that information. And the next time you go through it, it'll be much easier to understand. So don't get stuck. Just pick out the key things you want to remember from that specific topic. Remember, the way you're doing this is with each repetition, it's like something is coming into focus. So the first repetition, everything's hazy. Imagine like a hazy photograph. You can kind of see, I think that's a person there. I think that's a mountain there. Then it gets a little bit more crisp and you say, yeah, definitely a person, definitely a mountain, but I don't know who it is. Then a bit more crisp. Oh, that's Jeff. I recognize him. I don't know where that mountain is. And then with each repetition, it gets more and more clear. And by the time you've done few repetitions, you really know the information well. So I would aim for 1 to 2 reps on a strong or easy topic. And there'll be some topics where it just comes very naturally to you. And then 3 to 4 reps on a weak or hard topic. So this way you're focusing mostly on your weaknesses. And if something's strong, you shouldn't spend too much time on it because your weak areas are what is going to bring your exam score down. And then the final thing is so you're doing this throughout the semester. You start this on day 1 of your semester. You start this process, knowing what you're going to have to do in the exam in 3 or 4 months' time. And then 1 to 2 weeks before the exam, 1 to 2 weeks before the exam, you switch from this testing sandwich method. You stop doing the testing sandwich because you don't have the time to go through everything like this. And you just start doing rapid testing. And I recommend for rapid testing, you can use flashcards, like the Zero to Finals flashcards, and things like Anki or the Fact Trainer tool on the Zero to Finals members site. So this is where you just blast short answer questions, boom, 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 one question after the next until you're just kind of drilling them in that 1 to 2 weeks, really preparing you the last minute for your exams. At this point, the testing sandwich has already given you that kind of foundational knowledge, foundational understanding, bigger picture. At this point, you just want those key facts to stick in your brain. The other thing is you can do like self-testing, such questions with peers. So you get your revision group together and you just have fun with it. You're all just throwing questions at each other, trying to catch each other out, trying to drill each other's knowledge, trying to find the weaknesses and fill in those gaps in knowledge with each other. You can really just have fun with this. So that's it. That's the testing sandwich technique. I hope that video was helpful. If you want the notes, so these notes I've been making on this side, I've done a really nice version of those that you can download from the Zero to Finals Patreon, and that also gives you access to the member site. So if you're already a member, you'll be able to download these notes so you can use them as a quick reference rather than having to keep watching this really long video. But I'll see you in the next video, which will be tomorrow.